Hi, I'm Chris Christenberry, and we are going to chat with Dr. Andrew Shaw about psychotherapy and how psychotherapy works. Dr. Shaw, thank you for spending this time today talking about these important things.
Well, I'm really glad to be here. I love this subject.
You are trained, or were trained at the University of Cincinnati, I understand.
Yes, I was. I spent 4 years there in medical school, 4 years of residency to get my psychiatric degree.
So you actually did a medical rotation like in the emergency room and things like that?
Absolutely.
As well as specializing in psychotherapy. So
yes,
you're not only just a psychiatrist, you're a medical doctor, you can write prescriptions, you know psychopharmacology and those important aspects.
exactly. Yes, psychiatrists actually, just the word psychiatrist means that you are medically trained.
Correct.
So.
Versus a psychotherapist who may or may not be medically trained, but will have like a master's degree or even a PhD, but not an MD.
Right, exactly. That's the main differentiation.
When you left school, what track did you take?
Well, I was, my training was very eclectic. We had a lot of different types of training, and I got very good training in psychopharmacology, but particularly in depth psychotherapy. So when I left school, I've always been fascinated with depth psychotherapy and how it really works and how it actually changes the brain. And my expertise in pharmacology sometimes comes into play in the context of that kind of relationship.
And your real passion is long-term intensive psychoanalytic psychotherapy.
Yes.
Whatever that means.
Well, I think what that means is I'm really interested in getting in depth to the root causes. What is it that really is creating these symptoms or these problems in life interpersonally. So I guess the way to summarize it in a word is depth, I think, is important.
So describe your definition of psychotherapy.
Well, I like to keep things simple. I think the easiest definition is that it's a very unique relationship between two people, and that it's really based in a deep trust that forms over time. And I think the other component that's probably really important about it is that the therapist in the relationship has really had some depth training in how to manage and work with emotions. Not only the patient's emotions, but their own emotions. So I'm always a little bit wary about someone who might say that they practice depth psychotherapy but really hasn't had their own experience with psychotherapy.
So basically, I think I hear what you're saying is that unless a psychiatrist who is doing long-term in-depth psychotherapy has had an experience of his or her own in that same area by being in psychoanalysis, him or herself,
Right.
They're not going to have the appreciation for the client's state of being and be able to assist them as deeply as one might be able to.
Exactly. I like to say, if you're going to learn to deal with anything in life with some degree of nuance and expertise, you should probably consult somebody who's really has some of that expertise. And I think the main point I guess I'd want to get across is a therapist should be someone who has a lot of experience in dealing with emotion and primarily actually their own emotion. Because what we're really trying to help patients do is to go towards their emotions and investigate them, and that can be a difficult process. It can stir up fear, anxiety. A lot of emotions can be triggered in psychotherapy. Actually, that's probably the therapist's biggest hurdle, because of course people come in and they want to get better. But initially in psychotherapy, you're usually heading towards emotions or paradigms that people hold that have a lot of pain associated with them. And so when we begin to do that, they will experience a degree of discomfort, pain, but it's not for, you know, no reason. We're going there because we have to unpack that emotion. We have to sort through it. And we have to learn to experience situations anew and develop new ways in dealing with situations and people that have more health associated with them.
So a psychiatrist that practices psychotherapy, psychoanalytic psychotherapy, is a person who is well-versed in that process.
Exactly.
You sort of got into my next question, which is, how does a psychotherapist help a client or a patient?
Okay.
What is the process that a patient could expect?
Okay. Well, the beginning process is as I was talking about, helping the patient move towards emotion. So a lot of times I will sense a feeling or an emotion will come up in therapy, and a patient, often if they've grown up in a invalidating family or have had painful experiences, they want to move away from that emotion. And my first job is to often bring them back. It looks like that really hurts. Can you tell me what you're experiencing? Because in childhood, we often have only learned to deal with emotions in very crude ways. We push them aside, we ignore them, we try to distract ourselves. You know, we do anything we can in some ways in a very painful environment to avoid that emotion.
And in childhood, that's not necessarily unhealthy.
Thank you for bringing that up. Yes, in childhood, sometimes in very difficult childhoods, it's a survival mechanism.
Right.
Because there's no one there to assist the child in really being able to sort through that emotion.
Mm-hmm.
So the first phase is to head towards that emotion, and that can be pretty disorganizing. The patient, again, can experience some anxiety, some fear, all kinds of emotions.
So a patient may feel like he's not getting better, he's actually getting worse at the first.
In the early stages of therapy, I would say that it's not an uncommon experience to feel actually initially a bit disoriented. Well, let me take that back. I will say initially the first phase of therapy is really trying to develop trust. So usually that phase is fairly comfortable. But once trust has been established, as we head towards the emotions more deeply, there's a period of significant disorganization and discomfort. And the reason we're doing that is because that energy that's been stored in the mind and the body needs to be released. It needs to be explored in the room. And then we need to get comfortable with sitting with emotion, because in the next phases of therapy, what we try to do is then engage the frontal lobes in sorting through what that emotion was about. So, you know, why was it that when my wife said this, it triggered this emotion? What was I feeling? What was it that she said that hurt me? Why did I have this emotional reaction? What were my fantasies about what she meant or what she was trying to do? So we can really unpack and understand what are all the assumptions around these emotions that can get triggered. Because in childhood we weren't able to do that, at least a lot of us who may have had painful childhoods. And so we don't realize that we have already made a lot of assumptions about the way other people interact with us. And in some ways we're kind of stuck in this maze of responding in the same way that we've always responded since we were young. So we really have to look at that, unpack it, and that gives us the opportunity to really start anew and to develop different ways of interacting with people.
And a psychiatrist is going to be skilled at not only hearing what the patient says, but understanding the process behind it and why they could be talking about steamboats, but they're really thinking about pianos.
Yes. Yes. You know, we'll talk about that more in depth in our next interview, I think. But yes, thank you. The expertise is not only guiding towards emotion, but keeping back a bit in terms of one's awareness and watching for patterns that develop.
Mm-hmm.
You know, I once had a patient, for instance, near the end of psychotherapy who was talking about building a deck. And he kept talking about how this inspector was coming out and looking at his deck and not giving him the proper certificate so that he could finish his deck. Well, this was near the end of his therapy. And
it wasn't about a deck, was it?
It really wasn't about a deck. You know, as I was listening and kind of I'm standing back, and this gentleman was really often talked about emotionally charged things, and I'm thinking, you know, well, I wonder why he's talking about his deck. But then it hit me. What he was really trying to tell me in between the lines was, Dr. Shaw, I think I'm ready to finish therapy, but I need you to certify that I'm done.
Mm-hmm.
And so what I said to him was, Johnny, use a name to protect his identity, but Johnny, I think I hear you saying you're ready to end therapy, but you want to know where I stand on it. And he looked a bit shocked,
mm-hmm.
But he confirmed that just the day before he had been thinking that he was ready to stop. And so I think your point is well taken, that you're also listening with a kind of a third ear. In metaphor, you're listening to people's stories, and you are really trying to investigate what they might be telling you behind the scenes, so to speak.
So what I'm hearing you say, Dr. Shaw, is that no matter how serious an issue a person has, the skill of the psychotherapist can help that person begin to understand why a certain behavior is motivated by a certain emotion, and how to sit with the emotion or work with the emotion so that the behavior that's been problematic can be changed, and the ability to deal with the emotion that's created by whatever the stimulus is can be changed also.
Absolutely.
And the part of this happens because the person's brain actually changes, doesn't it?
Yes.
And we'll talk about that a little bit later.
We're going to talk about that in one of our other segments. But yeah, there's been research that shows that the way that the brain talks to itself literally changes. And I think I'll explain that a bit later. But one of the things I think that you said that was really important is it clears up a myth about psychotherapy, and that is that psychotherapists are not gurus who are going to show you the right way to live. We're not here to give you a lot of advice. What a psychotherapist is again a person who's been very well trained in how to manage emotions, and is more like a guide, you know, on a difficult trail, who, you know, can be very helpful in helping you to stay on track.
Mm-hmm.
But really, what they're trying to help you do is sort through your emotions so that you can decide a more creative and effective way to live.
Sure.
That doesn't mean a psychiatrist will never give advice, but that is not our primary role. It's to help you become much more comfortable and familiar with your emotional landscape.
Great. Well, this is an exciting segue into another topic that we're going to cover later on. Thank you for spending the time with us, and I look forward to the next video that we make.
Well, thank you for having me.
Have a good day.